Hello, welcome. My name is Maria Mavrides, and I'm a faculty member at the Hunter College CUNY School of Education. My study was conceptualized as a response to the policies crafted by the New York City Department of Education as they implemented universal pre-K, also known as pre-K for all. In 2014, the City of New York expanded pre-K access to all 4-year-olds at a very accelerated pace using a mixed delivery system, utilizing 40% of all the classrooms in public schools, and 60% of all the classrooms for pre-K for all came from community-based organizations called NICEs that included Head Starts and other independent childcare centers. However, they neglected to provide salary parity and work condition parity between equally qualified teachers in these two settings. This resulted in a massive exodus of teachers working at these community-based organizations and Head Starts, moving into public school pre-K for alls. These resulted in centers that serve low-income and marginalized communities at risk to cease operations. In 2019, after an arduous advocacy campaign, salary parity was reached with an agreement that Head Start and CBO teachers will earn the same salary than public school teachers by October of 2021. However, the agreement neglected to recognize the longer day and longer school year that Head Start teachers work, and also lacked to recognize the experience of teachers working these settings. It also neglected to recognize how directors were compensated, did not provide an increase in their compensation. As a result, many directors in these centers earn less money than the teachers they supervise. My study investigated how policymakers view the effect of these disparities as contrasted with those on the ground. Teachers, directors, parents, and non-certified teachers, which in New York City we call study plan teachers, that work in these community-based organizations, Head Starts and other independent childcare centers. I use interviews and document analysis. The document analysis was done with 36 documents and 6 years of social media collection. Interviews including parent, teachers, directors, study plan teachers, a total of 40 participants in a very diverse demographic variety of settings. The study found that the city, even though the city provided some parity, not much change on the ground, because policymakers neglected to provide what we call true salary and benefit parity, one that recognized the hours and commitment that teachers working at Head Starts and CBOs needed to receive. The study also found that there are striking geographical, racial, and setting differences, that is, Head Starts versus not Head Starts or non-independent centers, among stakeholders in terms of how staff and parents perceive their experiences with these policies, particularly compensation policies. Head Start focus on social support shines as an example of a setting that has been able to mitigate somehow the impact of disparities on families and teacher turnover. Minority women, particularly study plan teachers, those that don't have certification, bear the brunt of policy disparities, particularly as regulations regarding education and certification do not include appropriate monitoring of time release supports to comply to get that education that they are required to get. In general, my study found that more advocacy is needed at all levels of this ecological system of early childhood. Only when we have fair compensation policies across the board, we can think that pre-K is truly for all.